Curious about getting medical tattoos and how to set up a consultation? This episode's for you. My name is Nicole Rizzuto. I'm a licensed tattoo artist in Long Island, New York, specializing in medical and restorative tattooing. Today, we're going to talk all about how a client can set up a consultation, what to expect during that consultation, how to prepare for it, what questions to ask, and what credentials to look for in a medical tattoo artist. First things first, I usually recommend people who have had any surgical procedures and are inquiring about medical tattooing that they wait at least 6 to 8 months before even consulting a tattoo artist for medical tattoos. So, who would be looking for medical tattoos? Well, the common one is breast cancer survivors and previvors to complete and finalize their breast reconstruction surgery with a 3D nipple or areola restorative tattooing. The transgender community, also for gender affirming tattooing for either top procedures or some type of phalloplasty tattooing. Also, could be for someone who has some type of skin disorder, vitiligo, alopecia, things of that nature. Also, cuts, burns, surgical incisions, anything that again has some type of left a defect in the skin, and tattooing could improve the aesthetics look of it. So, I'm going to talk mostly about the breast cancer survivors because they do come with a lot of medical history. And I get a lot of questions from that community. I get a few from the transgender community and a few from people who've just had like cosmetic augmentation or looking to get tattooed. But again, the majority of the clientele that I work with is the breast cancer community. So I'm going to focus primarily on that. But there are correlations with medical history and things that anyone out there who is interested and not associated with having breast cancer or needing medical tattoos can also apply to you. So at this point, you probably got the okay by your doctor. You decided to find a medical tattoo artist to do your areola nipple tattoos. So what do you do next? Go on Google. That's usually how people find me or social media. I will give you some tips. There are some things to look for in a tattoo artist. Visit their website, make sure they have a visible website, look at their gallery, make sure that they have a good amount of their work of nipple and areola tattooing. Also, that it includes some type of healed photos as well, even maybe the whole step by step process of first session, touch up, final results. Look at their credentials that should be also listed. Things like having bloodborne pathogen certification training, licensing within that state of tattooing if it applies. Now, every state in the United States is different. And here in New York, I'm licensed through the health department, and I know some states don't even have tattoo licensing. So just make sure that whatever tattoo artist you go to, check your local laws to see what the requirements are for tattooing and if that person has those credentials, as well as a permit of the studio to perform those tattoos. So once you find an artist, you love their work, you went through their whole gallery, you've been following them for a little bit, and they're posting beautiful nipple tattoos, you can book a consultation. So consultations are usually in person. Most people can also provide virtual, meaning they can do a Zoom call or whatever if you're traveling far away or out of state. So, a couple of things to bring with you to prepare to have. Now, not every artist will want this or require this, but me being me, these are the things that I recommend my clients to bring. So, number one, any paperwork that may have a specific breast cancer diagnosis. What we're looking for are certain codes that insurance companies use to code your breast diagnoses. So, someone like me in my practice, I do provide itemized paperwork and procedure note and receipts stating that you received medical tattoos and it's medically needed for breast cancer diagnosis. A lot of times people know their specific diagnosis of breast cancer and then some don't. A lot of times too that I talk to women and they're kind of over the whole thing. They have, as they call it, chemo brain. They don't remember, and that's why it's okay We don't have to try to force something that you can't remember off the bat. So, ideally, if you have some type of paperwork that does have a specific diagnosis of that cancer, that's a big help for me where I can look it up in the codes and that's all I need. If someone has photos of their native nipple and areolas prior to having surgery and you want to give them for reference for color or design, or you want to replicate your original nipple areola complex because you like them so much, totally amazing option to do. Bring whatever photos you have. I've also had clients who have expressed to me they did not like their past nipples and they don't want anything to resemble them and they want something completely different. And if you have references again of something that you had in mind, bring those in too. So for me as an artist, when someone comes in as a new client, I do have a medical history form that goes into a little bit more detail of their medical past. Not just the surgeries they had, but other conditions like heart problems or autoimmune disorders, high or low blood pressure issues, or any other things that I feel I need to know to take care of you for a tattoo. I do ask a couple of times what medications you're on, supplements and vitamins and herbs, because a lot of those can interfere with the tattoo. And I want to discuss that with you. So, a lot of my clients as well are on a lot of herbs, a lot of supplements, a lot of vitamins. A good thing to do if you have a whole list, just write them down on a list, bring it on a piece of paper, and give me a copy, just so that the me or whatever artist you go see reviews it, make sure none of these supplements or vitamins could interfere. What do I mean by that? Meaning that some of these vitamins can act almost like a blood thinner. It can make you bruise easier, and that could be very difficult while we're tattooing you. So it's recommended, as long as it's not prescribed by a doctor for some reason, vitamins or over the counter stuff, to stop it at least a week before any tattoo procedure. So you're in the artist studio, you're filling out the paperwork, you've brought all your stuff because you're prepared. And now the artist starts asking you questions. So, how it usually should go is, again, they'll review the medical forms that you filled out. If they see any red flags or things that might be a concern, they will discuss it a little bit more with you. And then, usually, at some point, they will bring you into a private room. They will examine your breast reconstruction, kind of check the skin, look at the scars, make sure everything is looking okay. Now, around 6 to 8 months, again, which is what I recommend people to start thinking about planning for the tattoo. Some people may still be very red, some sutures may still be visible. It all depends. Everyone's going to heal differently, and the length of time definitely, differs person to person. So that's why examining that skin, making sure that maybe we need a little bit more time, those scars are still a little red, or I still see some visible sutures, or your skin's really dry. Common thing, especially working in the breast cancer community. Some people have been on chemotherapy or still on chemo. One of the things is that can make your skin really, really dry. That's one thing to, start recommending moisturizing the skin. Let's get it ready. Let's get it prepared. You want to make sure that your skin does get evaluated. Don't go to any artist who says, okay, sure, we'll schedule you and has not looked at your reconstruction, has not looked at your scars. That's a big red flag. First one, big red flag. They should always take a look at the area that you're wanting to get tattooed, especially if it's related to a mastectomy, reconstruction. And if you had complications and you listed that, but they're not even taking a look at your skin, that's something where I'd be like, excuse me, and I'll just walk out and then just find someone else, hopefully. So that's how usually it will go. And then the artist should explain the step by step process with you, what to expect, any kind of questions that you may have. Now, some questions I would recommend because once again, some people had that chemo brain, or it's just very overwhelming and it's just been one heck of a journey and it's not the easiest for many. This video is to help you kind of organize your thoughts and the right questions to ask a medical tattoo artist. So, number one, um, I would say, how many sessions will this be? And this will depend on artist to artist. I do this in a two-step process. I explain why during our consultation, talking about scar tissue and altered permanent skin. Another question to ask is, will there be pain? That's a big one. And that's a great question, especially if you've never had a tattoo and this will be your first one. It's usually someone looking at you with deer in headlights, like, is this gonna hurt? Great question. And usually the answer is, it depends. but because you did have some surgery on that side, sensation is definitely decreased. So it probably won't feel the same as if we were going to tattoo your arm, but it all depends. I always remind people that it's not going to feel anything like surgical pain that you experienced or went through because I've had surgery before, major surgery multiple times. It is painful. It knocks you on your butt, and I can tell you the tattoos will be nothing like that. Just to kinda set, a standard or at least, like, a mark of what to expect, and then it's gonna be way, way better than that. Third question to ask, and this kinda relates to anyone who had breast implants. Will the tattoo needles puncture my implants? Good question. The answer should be no. It should be no to every tattoo artist that you ask, and they should explain why. Because the needle depth that we use, even if it's very thin skin, stretched out, we can adjust to that thinness of the skin. But no, the tissue that's between where the implant is and then the surface of the dermis, there's still plenty of tissue in between that area that no tattoo artist should ever puncture a breast implant. If they do, they should probably stop tattooing. Just saying. Make sure you ask to go over about the instructions of the before and after care for the tattoo. So you may need to stop vitamin supplements. They will tell you no alcohol, usually 48 hours before, to take a shower, no lotions or creams on the chest. Can you bring someone? What can I eat and what I can't eat? How long will I be here for the session? And so on and so forth. But make sure you have verbal communication of what the aftercare instructions, how to take care of the tattoo is, and that you have a printable handout that they also give you that you can take home and review once your tattoo is done, and also beforehand to prepare for it if you need to purchase any products that the artist recommends. Just a fun little fact, and I think this could be a tip for the tattoo artists out there, just to make it more available to your clients, because I know me, I lose pieces of paper all the time. I leave my tattoo aftercare instructions up on my website. So if someone did lose them and for whatever reason and they visit my website, they can see, well, the aftercare instructions are there anyway, and that they can always have access to them no matter what, even if they lose their own personal copy. I think that's just a good business practice as tattoo artists. Another question to ask is insurance, reimbursement. That's a very popular one that I get. So this is going to be different artist to artist. I know some artists do work with medical billers who can do some type of authorization. I'm not really familiar with all of that. I'm not sure about pricing. I'm not sure how reimbursement or payment really works that way, but I can tell you what I do. And as a tattoo artist, I do have an NPI, a National Provider Identifier. It's a number that is registered to me, which identifies me as a medical artist in their database. So, because I have this MPI, I can create what's called an itemized bill, a procedure note, and proof of receipts that I give you, the client, to show that this was due to breast cancer reconstruction. It will have your information, your diagnosis codes, it will have my business information, and codes that are used for tattooing procedures. And it will show that I have zero balance, you paid me in full, and that the payment should go to you, the member, not to me. So that's how I do it. A lot of tattoo artists, I think, do provide that, again, if they have the MPI. If an artist does not have an MPI, does not register their business, I mean, they can write a note, but the insurance companies are very strict about how and what claims they will accept as legal, basically. So it took me a long time to learn it and figure it out and to kind of get the paperwork correct. So if you're not sure, ask the tattoo artist if they do provide paperwork or do they work with billing insurance, anything of that nature. When it comes to, again, like an artist like me who just provides paperwork, I do recommend that clients call their insurance ahead of time, ask to see where your out of network benefits are. Every plan is going to be different. So I've had clients who got 100% reimbursed. They got a paycheck or they got a check from the insurance company. Some people got a partial payment, a percentage of it. If that person had a deductible, The money kind of went to the deductible and it got reduced, but they didn't get any money back. Or like Medicare, Medicaid, they deny me no matter what, even though as if I've appealed it for them, they've written letters. A lot of times they just deny the claim because they don't recognize me as a medical professional, either a physician or nurse practitioner of that. Just so that you're not kind of surprised with what's going on, I always recommend clients call your insurance ahead of time, find out what your out of network benefits are, and what your results may be for paying out of pocket for medical tattoos. Another thing to mention, and hopefully this is going to be in the medical form that you fill out, is any allergies that you have. So the big ones that tattoo artists look for obviously are latex, people who may be allergic to certain Vaseline or petroleum products, certain fragrances, certain dyes. And a lot of times people have no allergies, seasonal allergies, some allergies to like antibiotics, which I don't use. So it's pretty straightforward, but for me, as a tattoo artist, I have a latex allergy. I developed it when I worked in the operating room and there were latex gloves, and I was never allergic to it before, but I developed an allergy to the exposure. So I am a latex free studio, mostly because I have an allergy, but I still ask people, do they have an allergy? Because there may be products that state that they're latex free, but a lot of factories share different products that they make in a building. So that conveyor belt that the product may be on may have been contaminated with something that had latex on it. So if someone did have an allergy to it, and it stayed latex free, I would document that they had some kind of allergic reaction, contact the company, see if it happens over and over again. But I do know if something does occur, I'm probably going to be the first one to find out because I'm touching the products and everything, setting things up. But this is something with just having due diligence with your tattoo practices is really good, and note taking and things like that. So make sure that you tell your tattoo artist any kind of allergies, even strange ones like grass. I mean, I don't know, but just tell them everything. It can't hurt, and it's just better to have the information. Some people may need medical clearance, meaning that when you see the tattoo artist and maybe you got the okay by your plastic surgeon, but you come in and maybe you have a lymphedema flare up and it's visible and it's active right then and there. And you don't know, you're not aware. You got the okay by your doctor and this occurred in between. For me, if that was a situation I had to deal with a client, I would tell them to number 1, refer back to your doctor, maybe your oncologist doctor, and discuss the issues with the lymphedema. See if you can do some treatments, compression therapy to reduce the lymphedema. Ideally, you don't want to tattoo anyone who has active lymphedema. Why? Because we are relying on the lymphatic system and our immune system to help heal, clean up any bacteria and stuff that may have been in the tattoo just naturally. And the wound healing process does rely on the lymphatic system and the vascular system. Now, if there is active lymphedema, it's usually an extremity like an arm, hands, things like that. But we know with breast cancer survivors, it's usually removed in the axillary or sentinel lymph node area, and we're going to be tattooing on the breast. So the indication is that something is going on in the system. There's a backup somewhere, right? Because lymph nodes have been removed, you have to think like the roadway was like kind of pieces of the roadway have been removed. So there's some blockage, there's some buildup of fluid, and that could lead into delayed wound healing and possible higher chances of infection because that system has been altered and the lymphatic system can't do its normal job. The indication, lymphedema. So for me, I usually tell clients to talk to their doctor, get a medical clearance, work on reducing the lymphedema if they can. If the doctor deems it's okay, I would still kind of proceed with caution, discuss everything with the client about the risks that can happen with lymphedema. Another reason why someone would need medical clearance, and I've had this a couple of times, is I've had metastatic breast cancer survivors who stage 4, they are on chemo basically for the rest of their life. It's being managed, but that's their situation, and they decide, like, "I wanna get these tattoos." Usually, I don't tattoo anyone who is on chemo because I do know that that also alters the immune system. It could suppress it, making them more vulnerable to getting sick. And again, a tattoo is basically creating a fresh wound. Don't want to mess with that, overloading the body with a fresh wound and having a compromised immune system. We want the body and you as healthy as it possibly can be to get these tattoos done. So if someone's still on chemo, medication or whatever, but they have an end date, I usually wait around 6 months when they're done with that last, chemotherapy, and then we can kinda reassess everything, make sure they're doing okay, and then we can plan for a tattoo. But there are situations where someone will never stop with chemotherapy. So I did have a situation with a client who, was metastatic, breast cancer. They were trying out this new chemotherapy, and I was very transparent that, I want you to double check with your doctor who's um, taking care of you with the chemotherapy treatments with this new type of chemo, and I want to make sure that you get medical clearance. So how we worked it out is she would get the chemotherapy and she would get her blood drawn, and as long as her blood levels were at a safe level, meaning, like, I guess her white blood cells were at a good level, that she can get the tattoo. So that's what we did. We did this 2 times because I do 2 sessions, and I wanted to make sure I opened up a dialogue with her doctor that they are aware that am concerned that, we don't cause any harm to her, and they agreed, and they wrote me the note, and they showed me the labs. I mean, I know how to read a little bit about labs, but not like a doctor does, but as long as I got that okay, the lab work is okay, she's okay to proceed, and she did great. But that's one of those things where, having red flags like that and to talk to your client and to tell them to discuss this with their doctor too, because again, as tattoo artists, unless you're a nurse or someone who has a medical license doing this in the medical field, if you're just a tattoo artist, within our scope of practice, we can't tell someone to stop a medication, stop chemotherapy, stop any treatment. All we can do is recommend that they go back to their doctor and discuss it with them. But as us as a tattoo artist, we feel like there may be an issue, so open up that dialogue to get that medical clearance from them. Another thing you can ask is pricing. So this is going to be something where, again, it differs artist to artist, but I would say this kind of can fall into when you were researching your artist. And not to be too negative, but there are some red flags that I know that are in the industry, meaning that say you find an artist and they have photos and stuff, but their prices really aren't that visible. You can't really find like how much this charges or how much that costs and what's their policy, what's their service and agreement policy, like, what about refunds if there is any? Deposit payments, payment of like if it's just this very kind of glaze of information, a couple of photos here and there, no, just doesn't feel professional like an actual business. And there isn't that transparency. I would say that might be a red flag because not that I've heard this happen, but it can. And this is just dealing with shady business practices that if someone says, like, oh, yeah, I'll charge you this. And then the day it comes, they charge you a different price, and you didn't sign anything or there's nothing on their website to prove otherwise. That's a little dodgy to me. So make sure when you are in that part of researching art artists that the prices are visible, it's transparent. And if you want to discuss anything about the pricing, breaking up the prices and payment plans or whatever, the artist should be open to that. And again, transparent about all their pricing. So a big one to ask is what are the risks? With any procedure, and I used to say this about this in the OR, and this includes anything that will make your skin vulnerable to accept pathogens, meaning we break the skin barrier from surgery, from, microneedling, whatever it may be, even an IV injection site. You're breaking your skin barrier, now has an opportunity to be vulnerable for bloodborne pathogens, bacteria, and so on and so forth. So there's always a chance of risk no matter what. The only 0% chance of risk is not getting the tattoo. This is the reality of it. But with proper protocol, aseptic technique, cleanliness, hygiene, all of these things, again, a tattoo artist who has been properly trained would understand this and be very strict about all of these practices will explain that to you. So that's why also going over the aftercare is very important. Make sure the do's and don'ts. Again, the big do's is don't touch it as much as you can. Avoid getting it wet or soaking in water, like submerging it in water. Saunas, pools, baths, jacuzzis, or the oceans are big no-nos. I would say for the least, the next few weeks when you're healing that tattoo. You don't want to use any fragrancy, perfumey type of lotions. Be careful if you have allergies to certain fruit or certain perfumes or things like that. A lot of tattoo bombs and stuff can have fruit extracts, papaya, mango, coconut, things like that. Kiwi, fun little fact for you guys out there. In the medical field, if someone had an allergy, I think to bananas, kiwis, maybe papaya, something else, that could be an indication that may also be an allergy to latex, I believe. So I always ask if someone's like, "I'm allergic to kiwi," like, "How you doing with latex though?" And like, "Oh, it's fine." Okay. But that was always something in the operating room that, if someone had these like specific fruit allergies, we would just do question mark latex and we would just be, use latex free products anyway. Again, go over the aftercare, what to do, what not to do, with taking care of the tattoo. And if there are any issues while you're healing, especially this is your first tattoo. A lot of people aren't going to know what to expect. So make sure that you have a contact information for that tattoo artist. Afterwards, if you have any questions, they should answer you very promptly. They should actually encourage you. Like, if you have questions, please, please, please reach out to me. And we'll guide you to see if this is something that's normal process of tattoos or if you should go seek medical help with your doctor or whatever. Another thing I want you guys to be aware of, just so that you don't get your hopes up, is that sometimes the tattoo artist will hold off on getting the tattoo. Meaning, you get there, you got your paperwork, you ask all the questions, you go through the whole process, and at the end, the tattoo artist says, "We're gonna have to wait another couple of months, and I'll need to see you again." It's like, oh no, I don't want to. I want to get my tattoo now. I always want to get my tattoos done yesterday. So I totally understand that feeling. But remember, we're working on a surgical site, we're working on scar tissue, we're working on skin that may be very damaged from radiation or necrosis, and this is permanently altered skin. We want to make sure that the body is safe and healthy enough to receive these tattoos. We will examine the skin again. If an artist doesn't, just get out of there. But because of that, if a tattoo artist notices red scars, any kind of situation indicating like you just need more time, they should morally tell you that. That doesn't mean no, it just means not right now. And as a reminder, you've come this far with all the surgeries and everything you've gone through, and everything has been okay up to this point. We don't want to ruin that experience with tattooing you too soon or not covering some kind of medical issue. We want you to get a clearance from your doctor. We're reviewing your medications and things like that. And then we run into some trouble, and dealing with an infection or some kind of issue with a tattoo takes a very, very long time. And to me, I would never want to ever think I put my clients in harm's way just to appease them to get the tattoo. I always want to make sure number one, safety is first across the board. And if I have to disappoint someone and say we're just going to have to wait a little bit, I will do so because I know it's for your safety and for my safety as well. I think that pretty much covers it, what to expect or how to prepare for a nipple tattoo consultation or a medical tattoo consultation. If you have questions that I didn't go over, leave a comment and I will definitely answer them. I mean, like, sometimes there's just so much stuff to go over and I forget things. But yeah, so if you have something that I didn't go over, leave me a message and I'll definitely answer you. If you have an experience of your own medical tattoo story and you'd like to share it on this podcast, or if you're a tattoo artist getting into the medical tattooing world and you want to have a conversation about how awesome it is, there is a Google form on my YouTube channel that you can click and submit your application to be interviewed on this podcast. If you find these videos helpful, please like and subscribe so I can definitely push out way more awesome videos to help you guys understand more about medical tattoos And if you have topics and things, again, shoot me a comment in the video. I'd love to hear from you guys. And I think that's about it. That wraps it up. So I just say make sure you come prepared. We're here to help. We will guide you to. I even answer questions people don't even think of, like, oh, yeah, it's a good question. Do some due diligence, do your research, make sure the artist has photos of their work, some kind of credentials, licensing, anything like that, visible pricing, and that you just get a good feeling from them. I mean, your intuition will always guide you into the right place. So, thank you again for joining me on another Alchemy Inc. podcast, and we'll see you all soon.